Hi everyone, my name is Kaylene Okada.
And my name is Christine Van.
Our research project is on systematic review of endpoints used in clinical trials of drugs to treat opioid use disorder. We'd like to recognize Dr. Nancy Pires-Merkanich for her support and guidance throughout our research process. We have nothing to disclose concerning possible financial or personal relationships with commercial entities that may have a direct or indirect interest in the subject matter of this presentation. Next, we'll go into some background.
A little bit of background on opioids and the current state of opioid use. So opioids are naturally occurring or synthetic compounds that are used to treat acute and chronic pain in many healthcare settings today. They can cause adverse effects such as drowsiness, constipation, nausea, euphoria, and respiratory depression. Over the past 2 decades, there has been a sharp increase in opioid use, and this has occurred due to three waves. So the first wave occurred in the late 90s, where there was a big push with pharmaceutical companies that manufactured opioids to increase their utility through providers. The second wave started around 2010, where there was a rise in heroin use. And the third wave started more recently, where we see synthetic opioid overdose related deaths, including fentanyl. Opioids can cause physical dependence in a short amount of time, and those who use them long-term can experience severe withdrawal symptoms when abruptly discontinued. This has led to the characterization of opioid use disorder, or OUD, which is defined by persistent cravings for opioid or misuse of opioids. Currently, there are 3 FDA-approved medications used to treat OUD. These are methadone, buprenorphine with or without naloxone, and naltrexone. And these come in a variety of different dosage forms as shown here. Recently, the FDA published an updated guidance for determining effectiveness of drugs for treatment of OUD in October 2020. This document is supposed to serve as a guide for helping sponsors develop drug treatments for OUD. Some recommended clinical endpoints researchers can look at include adverse outcomes, change in disease status, change in drug use pattern, patient-reported outcomes, and other outcome measures such as reductions in hospitalization, for example. Next, Kaylene will talk about our objectives.
So our objectives are to assess the current landscape of drug treatments for OUD in development, to determine whether treatments for OUD meet the updated FDA guidance for determining effectiveness, and to evaluate trends in the use of other outcome measures not listed as the main recommended endpoints in the FDA guidance. Our methods for achieving these aims will be discussed in the next slide. So for our methods, we use a two-pronged approach. We use PubMed to look for articles for background and to get a deeper understanding of the current state of OUD treatments. We also use clinicaltrials.gov to compile data on the endpoints used by sponsors. For the literature review, we use mesh terms and filters in order to narrow down the number of articles that are related to our topic. Some example mesh terms we use include opioid-related disorders, pharmaceutical preparations, and therapeutics. For the filters, we wanted to look at more recent articles within the past 5 years and focus on randomized controlled trials as well as some meta-analyses. For the clinicaltrials.gov search, we used opioid use disorder as a search term, which yielded 777 total search results and 683 after applying the interventional study type filter. Included studies were then sorted into 3 different categories: drug only, drug and behavioral only, with a main focus on drug only trials, which we found to be 33 trials overall. So we excluded around 635 trials, and for our exclusion criteria, we omitted investigator-initiated, US federal funded, and NIH funded trials. And the distribution of each of these can be seen in the pie chart on the slide. The reason for that is we wanted to focus on industry-related trials, since pharmaceutical companies are the ones that are responsible for and intend on commercializing drugs. So next we'll go into our results.
In this table, we have a summary of the primary and secondary endpoints that were used in the drug-only intervention trials. The next slide depicts the data graphically. So these endpoints correspond to the 4 main and recommended endpoints. As you can see, 123 out of 136, or 90.44% of the main clinical endpoints were incorporated as secondary outcome measures. Out of these secondary endpoints, patient-reported outcomes were more frequently incorporated, with there being 81 outcomes used out of the 123 secondary endpoints. Furthermore, change in drug use pattern was commonly incorporated as a primary outcome measure, which is what most trials have used to evaluate the effectiveness of medications for OUD, according to the FDA.
So for the other outcome measures, this slide shows examples of other outcome measures used by clinical trials that were not part of the main endpoints suggested by the guidance. We categorize them into 4 main groups: clinician-reported, patient-specific, benefits, and risks. This graph shows the number of drug-only intervention trials utilizing other outcome measures as primary endpoints. Out of the 4 other outcome groups, endpoints measuring intervention risk were most commonly used as primary endpoints for a total of 9 of 33 trials. This graph shows the number of drug-only intervention trials utilizing other outcome measures as secondary endpoints. As you can see, clinician-reported outcome measures were most commonly used as secondary endpoints, 26 of 33 trials. So now we'll talk about our discussion.
Our research plays an important role in providing insight for sponsors into the regulatory process of OUD treatments and to understand the relevant factors in creating efficacious drugs to counter OUD and the opioid epidemic. However, there remains a large behavioral component involved in OUD treatment, which is not emphasized in the updated guidance. Future research will focus on evaluating endpoints used in drug and behavioral-only trials. Surprisingly, out of 683 trials initially screened, only 33 drug-only, 10 drug and behavioral, and 5 behavioral-only studies were industry-sponsored, indicating that there may be a need for more trials to advance the development of OUD treatments and to incorporate more patient-reported outcomes as clinical trial endpoints. Regulatory processes should place emphasis on understanding the cognitive and behavioral components of addiction to better tailor our research towards mitigating risk factors that increase people's likelihood of misusing drugs. And that concludes our presentation. Thank you so much for listening. Please let us know if you have any questions.